Iowa is revamping its mental health and disability services. The plan reduces Iowa's 11 regions to 7 districts and relocates several service centers. Vivian Zudu shows us how this works and why one provider warns it could harm Iowans across the state.
Iowa's 32 separate mental health and substance use service providers will be put into one system. May Henshin, the CEO for the Eastern Central Region's Mental Health and Disability Services, says the plan makes sense.
That we know that people, when they experience a brain health issue, often as high as 77% of people who experience a brain health injury also have a concurrent concern with substances. So combining the policy and funding for behavioral health makes sense in Iowa.
This new system is revamping the state's 11 regions into 7 districts, with an average of 14 counties in each district. And each district will have a disability access point to connect Iowans with the disability services they need.
The disability access points are responsible for ensuring 4 key components for people with disabilities. So one is information and referral. The second key component is something that's called options counseling. Or the third one is something that's called short-term services and supports. And then the last one, the fourth one, is access to long-term services and supports.
But this overall does take away 4 sites previously providing similar services, doing away with regional coordinators that were there to help adults and children.
Yes, we've always done information and referral. We've always done service coordination. Yes, we've always helped people get access to services. And there are 11 regions. There are 11 CEOs like me. There are multiple staff. They're cutting the number of staff who implement our work.
Henshin says the changes are needed, but 34 people are losing their jobs just in her region alone, and it could lead to dozens more layoffs statewide.
It's really hard for me to look at 34 of my staff and tell them that they will be without a job. So it's a little hard for me to conceptualize how many staff of the 200 statewide will have jobs on July 1st, but I know it won't be all of them.
For now, Iowa's Health and Human Services is insisting that there will be no changes to services, but Henshin says we will have to wait and see.
Will it be successful? That will depend a lot, on what happens over the next year to 2 years, that we successfully transition this system and that we have the right partners to make sure that everything works.